What I have perceived workforce development to be is trying to bring exposure and bring opportunities to engage in healthcare, in the field of healthcare, to students and to prospective employees, giving them the opportunity to really explore these different options that there are within healthcare, because there are just so many.
I feel like the job shadow really helped and collected all my thoughts about really being a nurse. I feel like it's made my confidence go way up.
It's exciting. It's a part of you, and learning more about yourself through anatomy, through healthcare and everything is an exciting path.
It's very rewarding. I love taking care of patients. I love seeing their progress. It feels good.
I wish I had more opportunities as a high schooler to have learned about different career paths. There's a massive flux of information and it's hard to all grasp, but having a professional sit down with you and kind of break down what their job looks like, but also just some people want to understand how the body works. Some people want to understand how forensic science works. We all want to grow and have knowledge.
Career Connect Washington Grant has allowed us to really bring these opportunities to 8th and 9th graders. It's allowed us to bring exploration of these pathways that they didn't have before and they didn't really have the opportunity to see previously.
We live in such a small community that the smallest thing, the smallest opportunity can lead you to a bigger thing.
As I've worked and interned, I've been able to really see that there are so many different careers. Within the hospital, you can be so many things. You can be a secretary, you can be an engineer, you can be a lab tech, an image tech, you can do x-rays, you can work with patients in the ER, you can drive an ambulance, you can do all the different things. There really are so many different opportunities and so many different routes you can go. You can be an accountant, you can do coding, all just under the roof of healthcare.
I work at the Express Clinic and I am a ED or EC technician at the Express Clinic. I was made aware of the opportunity by some contacts I had in the community. I was given some suggestions, some career paths, and kind of where I could go with what I was already in schooling for, and I was suggested to get into Jefferson Healthcare, starting out as a reception care team specialist person so that I have my foot in the door and so that I could be hired internally through my schooling once it was completed.
Being a certified nursing assistant up in the ACU and ICU at Jefferson Healthcare really helped me determine to become a nurse. Not only am I doing my own work, but I'm watching what the nurses do. Of course, I'm curious. That little step of just being able to just watch them confirmed that I wanted to be a nurse, and I will be a nurse one day.
Having the opportunity to definitely job shadow and working on this grant has made me want to become a nurse more.
This opportunity to intern at Jefferson Healthcare has really given me the motivation, the perspective that I feel like I can continue forward in my education with an idea of what I want to do, and it's really given me the perspective I need to be confident in my decisions going forward.